Okay, so welcome everyone. Thank you for joining us. My name is Shelly Pedraza. I am president of SCCPTA. We have AdventHealth with us today. We have quite a few doctors, so thank you for joining us. We are doing a student panel. So the idea behind this is to make sure that our students get those questions that they have answered. So with us today is our student committee chair, Kirsten Trevino, and she will be the one going ahead and moderating the panel. So go ahead, Kirsten, whenever you're ready.
Yep. Hi, I'm Kirsten. As she said, I'm the student representative for SCCPTA. So I guess I start off with some general COVID-19 questions. So my first one goes to Dr. Levent and is, what are the side effects of children who contract COVID-19?
Thank you, Kristen. Actually, I'm just going to rephrase the question. It is really not the side effects, but the presentation and the symptoms for COVID-19 in children. Most of the time, children have asymptomatic presentation. So most of the time, you might not even know that they have COVID-19, or they have mild symptoms, cough, congestion, maybe low-grade fever. So that's majority of the presentation in kids. However, we have seen multiple kids who got into the hospital with pneumonia, high fevers, breathing difficulty. Those are more in the acute presentation of COVID. Also, we have seen patients from younger ages to older adolescent ages with a syndrome called multisystem inflammatory syndrome in children, so MISC. And that is a little bit different presentation than the acute one. It does have fever, it does have sometimes rash and pain and fatigue and sometimes respiratory distress, but most of them also present with abdominal symptoms like belly pain, vomiting, diarrhea, and that usually mimics appendicitis. So they most of the time end up into multiple ERs and urgent cares, and they end up in our hospital. The good news is they all get better with the care that we have been given so far. We have seen really good outcomes.
Yes, thank you so much. So my next question is for Dr. Hendrix, and the question is, what treatment is there currently for COVID-19?
Oh, thank you. Just appreciate the opportunity to be here tonight. I am the medical director with Centra, just a brief introduction. So I deal a lot with the outpatient world. So my answer to that question is the treatment, meaning you're not in the hospital but going home, pretty much there's no treatments for mild cases of COVID-19 because the vast majority of people will get over those symptoms on their own without any need for medications. But for people that are at high risk of complications, there is a new treatment. It's called a monoclonal antibody, and it's an infusion, a single infusion. You go into an infusion center, they put an IV in your arm, and they give you the antibodies. And this has led to a significant reduction in people ending up in the hospital from COVID. Now, the people that are eligible for this are those that are higher risk of complications. And we know older adults, people over the age of 65, are at highest risk of being hospitalized and dying from COVID-19. 80% of deaths from COVID-19 are in that older group. Also diabetics, high blood pressure, obesity, kidney disease. These are other reasons that people are getting this infusion. So we've been really excited about having something that we can do to prevent people from going on to that point of needing to be in a hospital. But I'll also add that when people do end up in the hospital, survival rates have increased. People have been able to survive an infection with COVID-19 even when they've been to the sickest point in the ICU, intubated, because of ongoing research and use of things like remdesivir, dexamethasone, convalescent plasma, things like that, that we're learning as we go, and finding these treatments are being very effective. So the short answer is, if you get COVID-19 and you're sent home, most likely, if you're younger and you have no risk factors, you're just going to ride it out and you'll be just fine.
Okay, thank you so much. So next we're going to be talking about some more vaccine-related questions. I think Dr. Gottschalk, I'm so sorry if I butchered that. And the question is, what does the vaccine do and how does it work?
I think Dr. Gottschalk is not able to join us, so Dr. Levent.
Dr. Gervais is also on from the emergency department, so we have several physicians who were able to join. They were busy clinically, but they're back.
Okay. So that one, I guess, can go for anyone that wants to answer that one.
Sure, I can actually take that question. So the vaccine is given to people who are healthy. So, you give the particles or parts of the actual infection or the virus, and depending on the technology that they have used, it might be different presentations and different responses, but most of the time what it does is it just mimics the immune system response to infection. So as you get parts of the virus, your body responds to it, and then by the time you get the infection, you're prepared, basically.
Okay, perfect. And then just a follow-up question for you on that one. Some people are wondering, if you receive the vaccine and are considered fully vaccinated, do you still have to wear a mask?
The answer is yes, and we still recommend that. There are still studies ongoing about this, and especially you have to wait a little bit until you have full protection. The studies are showing that after you have been vaccinated at least 1 week, we usually say about 2 weeks, but the studies show that even in 1 week after being fully vaccinated up to 6 months, it's protective. Of course, the studies are ongoing and we probably will have more information about that later. So the other issue is you don't want to transmit the virus to the others. You may have still infection. Even if you've received the vaccine, you might have a mild version of it, but you can transmit the virus. So we still want everyone to continue to use their masks.
But to piggyback on that, if you don't mind, the latest CDC recommendation as of the 2nd of April said that if you have received vaccination, so the 2 doses for the Pfizer, and then 2 weeks later, you're considered fully immunized, and same thing for Moderna, or 1 dose for the Johnson & Johnson vaccine, then you can be unmasked around a household that is low risk. And you can be around people outside and indoors around people who are low risk. So that is something also that is nice, because as we go forward with the vaccination, we are going to be able to release a little bit of the pressure of the social isolation that we have and the duress that we've all been under.
Thank you. That's great. Yes, that is a great update.
Yes, thank you so much. And then also to add on to your question or last answer, Dr. Gervais, what are the side effects of getting the vaccine?
The side effects are pretty mild in most cases, as any vaccine that you're going to get. So you're talking about fever, headaches, malaise, your whole body hurts, but not everybody gets those reactions. And then sometimes you can also have a local reaction. That means that where you were vaccinated, you'll have a little bit of a redness, a little bit of soreness. Actually, that's the only side effect I got when I got the vaccine, by the way, was a little bit of soreness in my arm. Now, very rarely you'll have an allergic reaction. And we're talking about 11 cases per 18 million, which is, again, par with all the other vaccines that we have. And that's the case, then you're going to need epinephrine. And I've seen 1 in the ER so far.
Okay, thank you very much. I just got my first shot on Tuesday and I just had some soreness in my arm, so.
And it went away.
Can confirm.
Okay, good.
And then our next question goes to Dr. Hendrix. How long is the vaccine effective for?
Yeah, I think we already alluded to this, but basically we're looking at 6 months or beyond. So we just got confirmation. Both Pfizer and Moderna have released information follow-up that people are maintaining antibody levels for 6 months. So we're hoping it'll be beyond a year if at this point. So get us through this pandemic. We'll probably have to go to a yearly booster like we do with the flu shot. Going into the future and changing as the virus mutates. But we're pretty confident and we're just thrilled with the results we're getting from the current vaccines that are out there.
Yes, thank you so much. And then I'm going to go back to Dr. Gervais. Is it possible for someone who has gotten the vaccine to give COVID to someone who hasn't had the vaccine? I think you kind of alluded to this, but if you maybe want to end.
So the answer is yes. However, it's very, 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 very rare. So, there's no absolutes in medicine, really. A lot of things can exist and happen, but it's rare. And so after a certain point, that's why the CDC said that once you're vaccinated, you can interact with people of a household that is unvaccinated because the benefits outweigh the risk. But if you have somebody in the household that have like lung problems, like COPD, even young kids with asthma, you might reconsider.
All right, thank you. So for my next two questions are going to go to Dr. Levent. So they're just kind of wondering, when can kids under 16 get the vaccine? I mean, we know right now, obviously, that it opened up to 16-year-olds not this week, but when do you think, or will those under 16 need the vaccine?
Actually, that's a great question. I'm wondering myself because I have kids under 16. So the good news is Pfizer just announced recently, end of March, that they are working on a phase 3 trial between 12 to 15 years of age. And I'm hoping by the end of this summer and maybe beginning of the school year, we might have some updates on that. And I'm hoping that the kids over 12 might start getting vaccinated. The other good news is both Moderna and Pfizer have started kid studies or children's studies from 6 months of age up to 11 years of age. And those studies are ongoing. So I'm hoping that they're going to be next after that. So I'm excited and I'm hoping that we can start immunizing kids as well.
And then how does the vaccine go for kids who might have chronic health issues?
So for adults, they have started giving the vaccine earlier, for the people who have chronic disease. And now we are down to 16 and everybody can get it. Unfortunately, because of the studies are ongoing and it's not approved for the emergency use, we can't really give it to anyone less than 16, including the chronic diseases. But I'm hoping that it's coming soon.
All right, thank you so much.
Thank you.
And then we're gonna move to a mask related question. Dr. Hendrix, I don't know if this information is available yet, but if you had to give your best educated guess, when will we not have to wear masks in public anymore?
Well, that depends on how many people we can get vaccinated in the next few months. So we really need to work on distributing the vaccine to our population, get what's called that herd immunity. The more people are vaccinated, the less likely the virus is to be able to circulate in public, and get to that point where we are confident that there's not enough virus in the community. I mean, it's not just a matter of everybody being vaccinated, but also not having a lot of infection in the community and get that risk low enough. So can that be this summer? Probably not. I would estimate that it's going to be into the fall when we're confident that that we don't see that transmission going on, because not only are we dealing with the virus, we're dealing with variants that can have some resistance, can transmit more easily. And the one message to remember is that even though we talk about these mutations or variants and their ease of transmission, they're still stopped by a mask. So, it's the crystal ball. Who knows with this pandemic, but we're hopeful by the fall at least, or at least I am.
Yes, I'm sure we all are.
Maybe we'll take a poll of the doctors on, I'm saying by Halloween. All right, we'll get rid of the other mask. We'll go back to normal mask. What do the other doctors say? Yeah.
I'm optimistic, but I'm going to go a little bit further. I'm thinking of early 2022.
Wow.
I think I'm going to go with also early 2022. However, I am hopeful that the college students and the high schoolers will be vaccinated by the time to go to school. And then starting in fall.
Agreed. I'm hoping so too.
You know, and that will be nice.
Just to add like an additional question, anyone can answer this. Do you think schools are gonna have like vaccine requirements for the COVID vaccine like they do for some others?
That's a political question that, requirements for vaccines. So that is for employers. So I deal with a lot of employers and businesses that are asking those type of questions. Do we require vaccines? Can a school, can a college, or can a high school require vaccines for all of their students? And I think our society as a whole needs to make that decision because it's fraught with a lot of pitfalls. But when we're talking about a highly contagious, dangerous disease, sometimes it takes extremes like that to protect people.
Yes. And you guys started talking about some of the variants. Dr. Gervais, do you think, will the vaccines protect us from these new variants?
Okay, so the answer is yes and no, like always. But you have 3 variants that I know about, and if any of the other physicians know more, let me know. But we're talking about the UK variant, we're talking about the South Africa variant, and we're talking about the Brazil variant. Now, the one that is puzzling researchers the most is the South African one. It's the one that is not showing as much protection once we're vaccinated. However, the early data from Pfizer and Moderna, and actually even Johnson, have shown that it is protective against the UK variant and actually also the Brazil variant. So hopefully there's no more coming up, but there probably will be. So it's all, in all likelihood, we're going to need a booster at one point, and the booster will be a little different, but we have the technology, we have the prints already. So the vaccine is made, so we just need to tweak it here and there to protect us against the variants, and it should be fairly easy to do it.
Yeah, I know one of our students asked in the chat, is there an advantage to getting one brand of the vaccine over the other? This can kind of go to anyone, but
I can actually start the discussion. So I would tell you, like, some of my family members got Pfizer, some of them got Johnson & Johnson. So I really think any vaccine is great if you can get it, and whatever is available for you. It's pretty good, and it's really not like, I know a lot of numbers are going around, like 90%, 66%, 72%. I feel like it's really hard to compare because it depends on the studies that they have done. And as you mentioned, many variants are being tested with these vaccines, and they have been effective. So I feel like whatever is available to you, you should get that one.
okay, thank you. And then Shelly asked in the chat, do we have any idea of long-term effects of vaccines and those with autoimmune diseases? Once again, it's up to any.
I'll try that one, I guess. No, I mean, in terms of long-term, we've, like I said, we've got 6 months of data at this point, which is typical for vaccine approval in phase 3 clinical trials, to go out that 6 months before approval. We know as people respond to vaccines that we just don't see, 2 or 3 years later growing a third eye, right? If you're going to grow that third eye, as many of my counterparts are waiting, all right, Hendrix got his vaccine, is something going to happen to him? People are watching and waiting, but as we know, things will happen in those first few months. There are no long-term effects that we have to worry about. But we've got a lot of data, and don't forget, We've got 50 million people in the United States that have completed their vaccine, and these people are being followed. There's a federal program to follow for any side effects, for any adverse events, et cetera. So this is probably one of the most closely monitored vaccines in history of the United States, because we're the CDC and FDA is watching us very closely. So we're very confident in the safety of this vaccine, or these vaccines. We got 3 of them now.
Yes, thank you. Oh, go ahead.
On that, I was just going to say that we haven't, as Dr. Hendrix mentioned, we don't really have any information after 6 months, but we haven't really heard anything about the vaccine. However, I want to remind everyone, we have been seeing a lot of different presentations of the actual infection, and some people are called long haulers, so they have been having symptoms for a long time, even months. So the actual infection can cause a lot of problems. If you can get vaccinated and protect yourself, I think it's the best thing to do.
Perfect. Let's see. Rachel asked, how do you talk about it, I'm assuming vaccines, with people who are anti-mask and anti-vax probably too?
Okay, I'll try that one. I think the easier way to approach it is not to be confrontational. You don't want to cause a conflict. You don't want to put them down. They have concerns. So, you like any other vaccination, like polio, measles, like any of the other ones, basically you have to listen, and then you have to present as clearly and as easily, basically, the scientific fact. And sometimes, when you just go with a friendship, I have a friend who actually has not vaccinated her friends. So, her children. And, it's every time I see her, we do talk about it. Slowly and surely, she's changing her mind. So it's just a game of patience. At least that's my personal experience.
Yeah. I maybe to add on to the question or just add an anecdote, I know a friend of mine, her family is very anti-vax, but she herself wants to get vaccinated but is under 18, so she doesn't have that parent guardian approval. Have you seen or maybe heard about that happening frequently? I don't know if any of you maybe.
Not as much, because again, these vaccines were only approved for 16 and over, and that's just Pfizer. Moderna is 18 and older, so we don't see as much of that with kids wanting to get the vaccine, because just that narrow age range, and even availability is only opened up this last week for children, or for people under the age of 50 in the state of Florida. So I was at our vaccine event for AdventHealth today, where we administered, when I'd left, about 4,000 doses to ages 18 and 16 and above. So a lot of kids there showing up, 16-year-old and older, showing up with their parents that were getting their vaccine. So I'm very encouraged by that. But when dealing with people that there's a very small percentage of my experience where people are adamantly anti-vax, and that's just enough to cause confusion and doubts in many people's minds. And when people approach me and have questions, and is it safe? I hear it's not safe. I hear it's blah, blah, blah. And those people just want answers, and they want it from a trusted source. So oftentimes after a quick discussion, they're like, oh, okay, that makes sense. I understand that now, because they're seeing, they're reading. So just when somebody is opposed to a vaccine or concerned about masks, et cetera, oftentimes their data is wrong. And if they get proper data from somebody they trust, they get redirected. So it's not as confrontational as I would have thought, especially in these vaccine events, because I get a lot of questions about pregnancy, nursing, future fertility, et cetera, from patients that come through getting the vaccine.
Yes, thank you so much. Henry, one of the students on my committee, asked, is there a reason to be concerned about the AstraZeneca vaccine side effects? I don't know if any of you are familiar. But
I can answer that one. So far, the World Health Organization and actually the European Committee for Health said that there were no concern. However, there has been some case reports showing that maybe the vaccine was related or linked to an increased amount of clotting. And so some countries actually decided to ban it, especially in Europe. And it's not available here anyway, in the United States.
Yeah, it did not sound familiar to me, so I'm interested to hear that. And then Chloe, another student on my committee, asked, where can you make an appointment for a vaccine in Seminole County?
I believe if you go to the Seminole County Department of Health, there should be a link to connect there. Down the street at the Vito Mall, they're still doing the vaccinations and having pop-up events through the health department, other events through FEMA. So those should all be connected. They're trying to get one centralized website, but I think your best resource is to go to the Department of Health or Seminole County Department of Health.
And to add to that, actually, some of the pharmacies, including Walmart, CVS, Publix, all of them are, also offering it. However, I have to tell you, I live in Seminole County as well, and it is really hard to find an open spot. The other center, it's Orange County Convention Center. They are offering it even if you don't live in Orange County. I think you can potentially get a spot over there as well.
Yes, thank you. And then Shelly asked in the chat, many anti-maskers say the masks are not good for health because of breathing issues, infection, etc. Is there any validity to this or these claims?
I'll jump on that one. As in family medicine, in occupational medicine, so dealing with a lot of businesses and our own 26,000 employees at AdventHealth who are required to wear a mask, there are no health issues that would prevent you from wearing a mask. It doesn't reduce your oxygen concentration. It's not bad for your health. And these loose fitting masks are totally safe for all populations. So sometimes we do get people with fairly significant lung disease, those people that may require oxygen, et cetera. So yeah, there might be some medical issues that the person's suffering from and make it difficult to draw air in through. But yeah, that's really few and far between.
Okay, thank you. And then Rachel asked, I'm not sure if you guys know this, but where is the funding for all these vaccines coming from?
Our taxes.
In other countries, it's the first time in history that countries are actually collaborating and trying to create vaccines together, and we're exchanging information.
Yes, and WHO is also trying to help out, and a lot of countries are pitching in to help out with the countries that are developing.
All right, thank you. Okay, yeah, we just got another question. Rachel said, do people who have already had COVID and recovered still need to get a vaccine?
I can answer that. It's a yes. Even if you've had the infection, we don't know exactly how long your antibodies last, even if there are some reports that it might be for months. There are some mild versions of the infection that you may not develop vaccines that would protect you. And then also the variants are out there. So we highly recommend, even if you had the vaccine, to go ahead and get it.
All right, thank you. That's all the questions I see so far and all the questions we had prepared. If any of you have any closing remarks about the vaccine or COVID, and you want to share, you can go ahead. We can start with Dr. Levent first.
Well, thank you so much for this opportunity and for having us. This is great, and I really appreciate the time. I just want to tell everyone to continue to monitor the news, monitor resources, and always go to a trusted source. Misinformation is one of the biggest problems we are having. So always consider that the information that you've read on a social media site might not be correct, and go to a trusted resource, your doctors, your appropriate places to get your information.
Oh, it looks like we have one more question. How long will the vaccine protect for? Do we need to have one every year from now on? Anyone has an answer for that? I'm not.
We already, we talked about that. So we're hopeful that we know at 6 months it's staying, we're same antibody levels. We're hopeful to get to a year. I think that it will probably get to a yearly type of booster to keep it the pandemic at bay. But that's yet to be seen. And so I'll go ahead, since I have the floor, and give my parting comments. There are 3 things I want everybody to remember in dealing with the vaccines. That number 1, they are highly effective. Don't worry about all the numbers. The only number you need to remember is 100% effective at preventing people from dying from COVID-19. Okay, the current studies show, all right, doctors don't like 100%, but I'll go ahead and say it. 99.9% effective at preventing death or serious complications like ending up in the ICU and intubated. So that's the only number we really should care about, is that's our goal, is to prevent death from COVID-19 and serious consequences. Number 2 is these vaccines are safe. They are, we know we've got a good safety profile at this point. And number 3 is the more people that get vaccinated, the sooner we can get back to life as normal. So, we've got to continue to get the message out there about safety, effectiveness, and everybody needs to get vaccinated.
Yes. And then last parting comment from Dr. Gervais.
Okay, well, thank you so much for having me. I guess I'll go with personal stories from the ER. I can let you guys know that it's working. The vaccine is working, because at the beginning of this pandemic, I would intubate, and I would actually put people on the heat to high flow and help them breathe. And I haven't seen as many cases anymore because the older population is getting vaccinated. Now, of course, I'm still seeing some, but it's not like before. Now I'm seeing a lot more the 35-year-old coming in with a high fever and body shakes and not feeling well because they were at a family gathering 2 weeks ago, or they were at a party or something like that, or sometimes they just don't know where they got it from. So I'm seeing a shift in the population in the emergency department. So it is working. The disease is not as severe, at least the acuity. I'm sure, obviously, there's still some, but it's better, and I can see the end in sight.
All right. Thank you guys so much. This was very helpful and very informative. And I'm really hoping your comments will encourage people to go get vaccinated.
Thank you.
Thank you for having us.
All
Thank
right.
you for joining us. We do have, apparently now everyone wants to ask questions. We did have, I think, 2 more questions in the chat. It's about it has to do with the children when they get vaccinated. If it does become approved for them, do we anticipate them having the same side effects? Like for that 12 to 15 group?
I can actually give you a little information about what they have been seeing with the studies, and it sounds like they saw really very, very little side effects, which is very similar to the older population, and it was very effective in this age group. And I agree, we don't like 100% in medicines, but they did report almost 100% of them were protected from the infection of this group. So their immune system responded really well and with very, very little side effects. So we're hopeful that it's going to be okay.
Perfect. Thank you so much once again. So that, as far as I can tell, is the end of all of our questions and the end of our parting comments. So I think we are finished with our student panel on vaccines. Thank you so much to the physicians who came here today. We appreciate all your work in keeping us safe and healthy. And I hope everyone has a great night.